Everyone. Welcome to the taped lecture for Chapter 11, Toddler and Preschool Nutrition Conditions and Interventions. This is a relatively short lecture, so two important objectives. We're going to describe how the key parts of a nutrition assessment and think about how this can be modified in children with special health care needs. And we're going to identify the common nutrition problems in special health care needs. Not all of them that are in the chapter, but what we're going to review in this online class period and think about how they are assessed and treated. So a couple of general concepts before we dive in. It's always important to remember that children are children first. So this means that whether you have special need or not, we're still going to treat children as children. They are different, certainly, than adults. They are not small adults. And so we want to remember that our expectations are actually the same, whether a child has a special need or not. If you think about some of the expectations that we have for children around food, we want them all to become more independent in making food choices. We want them to be able to assist with meal preparation, and we want them to be able to participate at meal times with other family members. And this is going to apply to children with special health care needs. Certainly they might need more assistance, it might take more time, but the goal is the same. You might think that nutrition and diet aren't very much related to most disability or special health care needs, but in fact, about 90% of children with disabilities have a nutrition problem. If you kind of think about the types of conditions that would interfere with adequate nutrient intake, if the disability affects the ability to chew or swallow or feed themselves, many health conditions require medications, and those can have side effects that might affect appetite or metabolism. Sometimes special health care needs have to do with behavioral issues, and this can lead to more food refusals and food jigs and picky eating that might be considered extreme. And then some children have healthcare conditions that require them to restrict certain foods. So celiac would be a good example of that. Following a gluten-free diet is difficult for anybody, but certainly a child having that responsibility would be extra challenging. In terms of our nutrition recommendations, we don't have specific DRIs, dietary recommended intake, for every single special health care need. Remember that the DRIs and the dietary guidelines are meant for a generally healthy population, but we have to use that as a starting point. So we start with the appropriate DRI and we adjust accordingly depending on the special need. Here's an example of chronic conditions generally associated with high and low energy needs. So here's a case where we'd start with the normal calorie recommendation. So how much energy would a child need? And then we would have to adjust it potentially because of the health condition. So the types of conditions that require more calories or higher energy needs include cystic fibrosis, renal disease, ambulatory children with dysplasia, pediatric AIDS, and bronchopulmonary dysplasia. So these all increase calorie needs because metabolically they're challenging. It's more difficult to breathe, or it's more difficult to move, or your immune system requires more energy to fight off things. So especially sometimes protein for some of these, and just higher calories in general are going to be important. For those who might need fewer calories or have lower energy needs, you can look at the list here, and it's really mostly related with activity level. So if the special healthcare condition reduces or makes it more difficult for normal activity that we'd expect in kids, they probably don't need as much calories to maintain their weight and grow appropriately. I'm going to go over some of the more common ones. So Down syndrome we've talked about before. It's an example of a genetic disease. There's a change in the chromosome, so we know exactly which chromosome it is. This isn't caused really significantly by nutrition, but we do tend to see more obesity in people with Down syndrome. They are more likely to have a low thyroid, which would lower metabolic rate. They're more likely to have short stature, so have a shorter height, meaning that their body weight is going to be less if you think about how we calculate BMI. And of course, sometimes we don't have the same activity level. When kids are maybe not quite as coordinated or don't have all the same opportunities. Prader-Willi syndrome is another genetic disease. It's much more rare, but it does have a very serious nutritional risk of obesity. That's actually the hallmark of this syndrome. You can see as an infant, this child has hypotonia, meaning they have less muscle tone. So it would be noticed at an early age. You can see the picture of a child at a little bit older age, and they clearly are developing or have obesity. And that's because Prader-Willi impacts the part of your brain that controls appetite. So people with Prader-Willi are extremely hungry. Their appetite is greatly increased, and that is, again, it's not behavioral, it's physiological due to the changes in the brain. And so it's tremendously difficult to help these kids who will always have it. It's not something that can be cured, manage their appetite and their weight. Spina bifida is often caused by nutrition-related factors. This is a neural tube defect. It presents in a number of different ways, but most often there's a derangement in the formation of the spinal cord. So children are born with this. One of the risk factors is having low folate status during pregnancy. It is not reversible, and depending on the degree, so how much is impacted, children may be only able to move with a wheelchair. I've seen other children with this who can move, but they need braces on their legs and different types of things. But certainly it reduces physical activity or has a high risk of reducing physical activity. So we do tend to see more obesity and more constipation because of that. Cerebral palsy is a disorder of motor control or coordination resulting from injury to the brain during its early development. So sometimes even during childbirth, if there's some reason that oxygen got cut off to the brain or something similar to that, permanent damage can result. We do tend to see poor nutritional status and growth failure because of the motor control issues. It's sometimes difficult for children to feed themselves and chewing and swallowing difficulties because they're probably or might not be able to walk or move. You're not putting pressure on the bones, and that can cause low bone density. Now, some of the strategies that have been used, first of all, keep in mind that with all of these special needs, it's not just nutrition that's part of the intervention, it's a healthcare team. In this case, you're seeing someone who's using an adaptive device to eat. So if they don't have the motor control to do that themselves, there's things that an occupational therapist could help them with to allow them to be more independent, like we talked about at the beginning, where we really want kids to have the same opportunities and skills as anybody else. If it's eating is really difficult for someone and it takes a long time, you could think about strategies related to the meal pattern. So having smaller, more frequent meals and snacks, so you're not wearing somebody out or making them feel tired, sometimes to the point where they don't eat as much as they should. You might have to think about easy to chew foods and soft foods also to make it easier. And again, the adaptive feeding tools, which an example of that is shown in the picture. is a big, broad category that tends to get a lot of press, autism spectrum disorder. So that is a very wide disorder. There's very complex and different degrees. Usually it's characterized by difficulties in social interaction, communication, and repetitive behaviors. There's been an increase in prevalence over the years, so a lot of people talk about it and speculate if food or diet causes autism spectrum disorder. It's really still somewhat unclear about this. When does nutrition matter? Should we be thinking about nutrition for prevention or nutrition interventions as part of the treatment? And if so, what nutrients are we really thinking about and which ones are important? If you're wondering what these pictures are, this is from Rain Man, which is a movie. That's Dustin Hoffman at the top. And the other one is from, I think the name of the show was Parenthood. But both of the characters in these television and movie shows had autism. So the public is generally aware of what autism might look like. If you have kids or are planning to have kids, they will be screened for autism during their normal well visits, which would be like a physical. Like most things, prevention is key, and signs of autism can be detected quite young. Screening can start at about 18 months. A reliable diagnosis, because it is rather complex, can be usually made around age 2, although even that can be even younger with really diligent screening and intervention. Some examples of things that they would be looking for when they're screening, things related to social interaction. So, an 18-month-old isn't talking enough to know if they have social issues, but they might avoid eye contact. We usually expect kids to start talking fairly regularly around age 2, but that might be delayed in someone on the spectrum. Restricted behavior, a lot of kids have this, but if it seems a little bit more significant, if they're really attached to certain objects, fascinated by spinning objects, have a strong need for sameness, it would be something that you would talk to with your pediatrician. So that's screening. If it seems like there might be some signs, the second step towards a diagnosis is a very comprehensive evaluation where someone's really examining your child's behavior and development. They're interviewing the parents, thinking about what be other causes. So hearing and vision screening can certainly change behavior. Genetic testing, neurological testing, and other types of medical testing. You certainly don't want to misdiagnose someone, so you really do want a good medical team involved. Now think of how this might relate to nutrition. Children with autism often fixate on certain foods or are very sensitive to texture. They're often described as difficult to feed or very choosy or picky, even at very young ages. Research has shown even as young as 15 months, they're not very adventurous with food. They're not eating like the rest of the family. If you want to look at that YouTube link, it just describes some different stories about children with autism and some of the feeding challenges. So does this put them at nutritional risk? Well, of course it does. If you don't have a wide variety of foods, if you're just kind of eating the same few sort of bland, usually highly processed foods, it's not promoting good health. Is picky eating a sign of autism? I mean, that's very, very tricky, right? A lot of kids are picky eaters. And are special diets needed? That's a really interesting question. And you hear about this all the time. The video down here is in kind of a talk show clip about a doctor who's putting on kids on casein and gluten-free diets and claiming that that helps children with autism. I'm going to speak a little bit more about this. It's a really interesting topic. I will say that There's certainly stories, parents talking about how having a gluten-free and casein-free, which would include like all dairy milk products, if you avoid those, they did seem to notice improvements in behavior. But the randomized clinical trials that have tested these diets have really been inconclusive. So it's something that if you know someone or have experienced this yourself in any way, you really want to make sure you're getting good professional advice before you try anything very drastic. All right, attention deficit hyperactivity disorder. This is people who are easily distracted, more impulsive, and are very, very active, hyperactive. This can be diagnosed at any age, and young children under the age of 4, we would tend to see more frequent and violent temper tantrums, poor sleepers, and picky eaters. Again, if you can kind of think about children under age 4, they all have some of these problems. So determining whether or not it's true ADHD would require the help of a professional. What causes it? People speculate by that all the time, but it's very likely caused by biological factors. So this is somewhat of a neurological disease influenced by neurotransmitter activity in certain parts of the brain, and it's very much likely that there's genetic factors at play. So what that means is people often associate ADHD with sugar. When in fact eating sugar, while I don't highly recommend excessive sugar intake, is not what causes ADHD. In fact, the major nutritional risk is people who take the medications. A side effect of the medication is poor appetite and weight loss. So these kids sometimes really have trouble eating enough to support their growth. So as I mentioned, I think sugar does raise children's energy level, but that doesn't mean it causes ADHD. People have explored using sort of anti-inflammatory mechanisms like omega-3. The other thing that people look at is food additives, especially food dyes. So if you look at the picture and you kind of think about foods that kids like, they do like colorful things, right? But often that means that a food dye has been added to it that would put it into the category of a processed food. And there is some evidence that that increases hyperactive behavior. So my kids have a lot of energy. They do not have ADHD, but I still try to avoid these foods. I don't think anybody really needs to be eating food dyes. Even if they're generally recognized as safe, they do mean that the food is processed. Food allergies, you've probably heard me talk about, is something I'm very familiar with because both of my kids have them. It's an immune-mediated abnormal response to food, usually the protein in the food. It involves multiple symptoms. So you have a food that you have an allergy to, the immune system responds, usually very quickly or acutely. That response typically involves the skin, so think about getting a rash or hives. Respiratory, think about having trouble breathing and wheezing. Cardiovascular, so think about a rapid heart rate. And of course the GI tract, think about vomiting and diarrhea after eating a food you're allergic to. A food intolerance doesn't usually involve the immune system. That's usually just something that upsets your stomach. Vomiting, diarrhea, that type of thing. Not fatal, but certainly not comfortable. About 2 to 8% of kids have food allergies. That's a very high number, higher than it used to be. Here's the common list. Sorry, I went a little quick. Food allergens do have to be listed on the ingredient label. They have to identify if any of these common allergens are in foods. Because it is such a significant problem for so many people. So milk, eggs, wheat, peanuts, walnuts, soy, and fish, especially shellfish. You think about if you've ever seen someone have a reaction to a food, the first one, anaphylaxis, is the scariest and the one that can be fatal. Usually, anaphylaxis is to nuts, peanuts, which is technically a legume, and seafood. So people who were worried about having anaphylactic shock should carry EpiPens. If you're ever interested, I have about 1,000 of them because they expire and we keep buying them and then we keep saving them. Probably not good practice, but EpiPens are epinephrine, and if someone's airway is closing up and they can't breathe, that shot of epinephrine usually is able to calm that down and allow someone to breathe while you get them to the emergency room. Oral allergy syndrome is when you feel itching and tingling in your mouth after eating usually fresh fruits, vegetables, nuts, or spices. Cooking fruits and vegetables can often help with this. I know so many people who have this to certain fruits and vegetables, and usually they just avoid it because it is kind of uncomfortable. An allergic esophagitis or gastroenteritis is inflammation and infiltration of the esophagus, stomach, or small intestine, which is also going to be uncomfortable and might cause vomiting or diarrhea. So if you ever thought to have food allergies, you'd want to go see an allergist. They'd take a very careful history, including medical and reaction. So if you've ever eaten something, what happened? They'll do a normal physical. You'll likely have to keep a diary where you talk about the foods you eat and record any symptoms. Both of my kids have had this allergy testing. That's what's shown in the picture, where they actually inject the allergen and look to see if you get a raised bump. So the more there's a reaction, the more likely you're allergic to it, although those tests don't always work. Food challenges. My son's had a food challenge where he, over time, reacted less and less to peanuts. So they gave him a very small amount of peanut butter about a year ago, and he tolerated it. So they kept giving him more and more, and turns out he can now eat peanuts. Done under medical supervision, but certainly that was very comforting to me to not have to worry about at least peanuts for him. Now, if you think about allergies, I'm always amazed that that nutrition isn't more involved. So you get diagnosed with an allergy and then now you're on a restricted diet, right? You don't eat those foods. My experience with allergists is then they don't really acknowledge that you might have to get those nutrients from other places in the diet. So think about if you had a dairy allergy, right? No milk, yogurt, cheese. We certainly have a lot of non-dairy substitutes now, but they're not always fortified like our dairy products are. So especially for young kids, dairy is the major source of vitamin A and vitamin D, and also riboflavin, calcium, and phosphorus. So if they are cutting that out of their diet completely, you want to be thinking about alternatives. Usually soy milk is the best in soy products because they're often fortified with the same things, but you certainly want to be aware of that. My son outgrew his egg allergy, but he had it when he was younger. Eggs are a good source of B12 and riboflavin, and one of the only food sources of biotin. I didn't worry too much about the egg allergy, especially because he outgrew it fairly quickly, but you might have to consider supplements depending on how restrictive the rest of the diet is. A wheat allergy, and this would include anyone with a gluten allergy. We get a lot of nutrition from our wheat products. So think about all the different cereals and pastas and breads that usually make up about 50% of a child's diet. You'd have to really think about how they're going to get fiber. Almost all the B vitamins are added to wheat products, so that includes thiamine, riboflavin, niacin. Iron is often fortified in wheat products, as is folic acid and mineral magnesium. So, what would one do if they were avoiding all of these products? You really have to make sure they're eating a wide variety of other foods. So certainly beans and legumes could provide some of these nutrients. Um, Meat, protein, and fish would provide the iron, but you might need to consider a supplement. Nut allergies, this always sort of drove me crazy that I couldn't give my kids peanut butter and other things like that, which has so much nutrition in it. So think about vitamin E, niacin, magnesium, manganese, chromium, and healthy fats. I often used seeds and soybeans, flax seeds, chia seeds. All of those things provide a lot of the same nutrients and tend to not be allergenic. Um, I'm obviously pretty motivated about all of this, but you really do have to be careful. The more allergies you have, the more likely you are to start to develop some of these deficiencies. So thank you for your attention.